and good morning. August 28, 2025, I'm Dr. Duke Machen, CEO and founder of Duke Spine. We are here with a patient who has back pain. He's had chronic back pain for 40 years. Works out at the Space Center, United Launch Alliance. He's one of those people out there who launch rocket ships. I told him today we're going to launch his back pain into space. So, thanks for joining us. He has two discs that are degenerated, L4-5, L5-S1. We're going to go in and fix those on the right side. I'm going to numb up his skin a little with some numbing medicine. He doesn't like that. But we're going to first start by placing our needles into the two discs that we're fixing. And then we're going to bring in our scope and do the Duke laser disc repair. Any questions? Feel free to type them up. Henry will ask me, and I will do my best to answer them for you. All right, the first disc is 5-1, very collapsed. You can see the vacuum space phenomenon happening down there. Shot. Henry, in the meantime, let's show the audience that there are, 30 different things that do cause back pain. Let's show the audience those 30 things. I'm Dr. R. Duke Machen with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic sciatic pain down their legs with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Machen. Thanks for joining us. Welcome back. So you can see from our animation that there are 30 specific causes of lower back pain, 30 to be exact. And they include things like disc injury. We call it disc injury because there's 10 things that you can put into the disc injury bucket. Herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, slip disc, degenerated disc, spondylitic disc. I mean, those are the 10 things, okay? They're all the same thing. It's a disc injury, and it's the injury in the disc that causes back pain. 85% of back pain comes from disc injuries, like this patient's pain. Then you got facet pain, which comes from facet joints, which he does not have. Sacroiliac joint pain, he does not have. Piriformis pain, he does not have. He's got pain coming in this area for 40 years. Okay, you awake? You having any pain?
You all right? Good.
You having any pain?
No pain.
Wonderful.
All right. Don't move.
How bad is that on a scale of 1 to 10?
Give us a number.
How high? 10? I heard
Pick a
10.
number.
He said 10. So he's talking a lot, but that was a 10. Is that where you get your back pain? Is that the area you get your back pain?
That's where you get your pain? Yes.
All right, we don't need a book. We just need a quick answer.
You're in surgery.
All right, so we found one of your painful discs. That was the L4-5, by the way, 10 out of 10. Is it better? All right. How bad is that on a scale of 1 to 10? 10? All right, is that where you get your back pain? All right, my friend, we got good news for you. We're going to send your back pain like a rocket ship up into space. You'll never see it again after today. It's gone. You like that? We're going to put it in orbit. All right. Count from 1 to 100 out loud for me. Nice and loud. Keep going. All right, so folks, he's counting. He's going to go to sleep. When he's asleep, we're going to start the surgery or the rest of the surgery. Basically, he's got concordant pain, meaning his typical back pain at L4-5, L5-S1. We tested both this. You can see that on the discogram. This was a 10 out of 10 at 5-1. This was a 10 out of 10 at 4-5. Great news for the patient. We found the source of his pain. We're going to go in and repair his 2 discs now. What do we got, 4-5? Shot? Keep counting. I'm listening. If you have questions, type them up. In the meantime, Henry, let's show the audience. By the way, you're watching a Duke laser disc repair marker. He's had back pain for 40 years. All right? Lower back pain, 40 years. And right here, this is where his pain was, right in this area, okay? And that's where we just verified the 2 discs. Duke Spine Institute is the first in the world to consistently diagnose the cause of back pain and be able to cure it. Any questions, Sean?
At this moment, no current questions.
We're at 4-5, right?
Yes, sir.
Sean? So right now I'm taking out the needle, leaving the guide wire. The needle is bent a little bit. I had to bend it to get it in the disc. Shot. Take a look at this needle, folks. It's pretty funny.
Oh my goodness, we can see it.
All right. Sometimes you gotta jockey the needle down. Look at this. We've lost literally 3 drops of blood, maybe 4 drops of blood, the whole surgery. There's the dilator. We're gonna slide down the guide wire to the L4-5 disc. While I'm heading down there, I'm gonna put some numbing medicine so that he doesn't have too much discomfort, because nobody wants a metal spike put in their back. All right. Any questions?
At this moment, no current questions.
Holy Hanoi. Henry, let's show the audience then. Why does this patient want the Duke laser disc repair? He waited about 6 months to get this done, and he didn't want to have anything else like a fusion done because he knew this was the best. So let's show the audience why the Duke laser disc repair is better than other treatments your doctor will offer you.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Welcome back. Wait, you just showed Duke laser disc repair versus all other?
No, just how to cure.
Oh no, I wanted Duke laser disc repair versus all other.
Oh, copy that. We'll do just that.
Hi, I'm Dr. Duke Machen. We've just completed our free MRI review with Duke Spine Institute, and I've diagnosed you with discogenic back pain. The spine is made up of many bones and joints. It's the joints that are actually the source of back pain. The disc is by far the most common source of back pain, as is in your case. It is the cause of your back pain, the primary cause. In your case, the primary cause of your back pain is an injury to a disc in your lower back that's causing inflammation, and hence back pain from the inflammation. Inflammation is the source of all pain in the body, whether it's a broken bone, whether it's an injured joint, or an arthritic knee. Pain comes from inflammation. Inflammation is a process where your body is trying to repair a damaged joint, and it creates swelling, tenderness, heat, and pain. The pain you're experiencing in your lower back is primarily coming from a small tear located within the back of the wall of a disc. Now, I may have diagnosed you with more than one disc as the source of your pain, and each of those discs cause pain through the same mechanism. As you see in our video, trauma causes a tear in the back wall of the disc called a posterior annular tear. At the same time, it fragments the nuclear material just inside the wall, and over time, after the injury, you, through activities, push out small fragments of disc herniation into the tear, which then causes cycles of inflammation and pain. And that's why you're experiencing your lower back pain. At some point, your back pain could become permanent and not just reside in your back and not ever leave. But typically, people go through a phase where the back pain is cyclical, where it comes and goes, and activities are generally the cause of the back pain flare-ups. In your case, we can fix your back pain by performing a state-of-the-art procedure only available here at Duke Spine Institute. This is a minimally invasive arthroscopic procedure performed with a laser. This procedure is called the Duke Laser Disc Repair. We've been performing the Duke Laser Disc Repair since 2006 here at the Duke Spine Institute. To date, we've had 0 complications. The Duke Laser Disc Repair is the safest, most effective treatment for back pain coming from an injured disc like yours. We're recommending you consider the Duke Laser Disc Repair as your primary and main treatment option to get rid of your back pain quickly and permanently with minimal impact on your life. Recovery from Duke Laser Disc Repair is just 1 hour. You're going to go back to your hotel after the surgery. You'll spend the night in your hotel recovering, and then in the morning you'll come in for a quick checkup. The checkup usually takes about 30 minutes, and then you can go back home after the checkup. Alternative treatments to the Duke Laser Disc Repair are far more invasive, and the outcome of those treatments is far more uncertain. There are many surgeons offering treatments such as laminectomy, discectomy, spinal fusion, disc replacement. Other treatments include injecting materials into your spine, such as epidural steroid injection, or injecting material into the disc itself that will supposedly repair the disc. I can tell you, we used to perform these treatments and they don't work. They either don't work or they don't last. And if they do work, they work temporarily, and they're associated with a high complication rate. For example, laminectomy is highly invasive. There's destruction of muscle and bone and ligament in your spine. When the surgeon removes the bones and ligaments out of your spine, it creates tremendous amount of scar tissue and instability of the spine. Patients frequently come back needing spinal fusion. Patients with laminectomy are often in chronic back pain for the rest of their life, going in and out of pain management, on and off of pain pills, and in and out of physical therapy. They frequently require multiple surgeries in order to feel some type of pain relief. An alternative treatment is called a microdiscectomy. Microdiscectomy is another invasive procedure where the surgeon is removing bones and ligaments to get down to a herniated disc that's pinching a nerve root. Microdiscectomy is not a treatment for back pain. It is only recommended for leg weakness, leg numbness, and leg pain. Microdiscectomy does not fix back pain and should be avoided if you have back pain. Laminectomy does not fix back pain and should be avoided if you have back pain. Spinal fusion is a treatment for back pain. The surgeon must either remove or fuse the disc using hardware such as screws, rods, and bone graft, including cadaver bone graft. You're receiving biological bone graft from a dead person. That's what's allowing your bones to fuse together. Now, these spinal fusions can be quite effective at eliminating discogenic back pain, which is the type of back pain that you have. However, they carry a very high risk of complications. Complications such as blood clots in your legs, which could migrate to your lung and kill you in a process called pulmonary embolism. They also have a high risk of infection. Every patient that does a fusion requires postoperative narcotic opioid pain medication. Opioids are known to be dangerous, addictive, and have a high potential for abuse. You don't want to start opioid painkillers if you can avoid it. With the Duke Laser Disc Repair procedure that we have recommended for you, there is no need for postoperative opioids. Our patients are treated with a small 7mm incision. That incision has minimal to no bleeding, and it heals within a few days. There is no need for narcotic painkillers. If you have the Duke Laser Disc Repair, we can fix the back pain within 3 days coming from your damaged disc. We recommend you talk to our schedulers. They'll answer any additional questions you have. We'd love to see you here at Duke Spine Institute and provide you with the highest quality, most advanced treatment in the world that gives you the safest, most effective outcome in the world that lasts a lifetime. Thank you for listening. And welcome back. We are just finishing up our first disc repair, L4-5. And we're talking about movies. And I heard we have some questions,
Yes,
so we'll
yes.
take those.
We got a few questions. This first one is coming from Jason on YouTube.
Hi, Jason on YouTube. Welcome.
This is Yeah, this is a comment saying thank you so much for having having the balls to do these procedures live. I wish there was more of this in the industry. It's educational and calming / reassuring for someone who is anxious. I have an appointment at St. Vincent Hospitals in Melbourne, Australia, September the 9th, about my disc pain and facet joints. I will let you know what they say.
Yeah, sure. Thank you, Jason. Yeah, the problem, Jason, to be honest, is doesn't matter where in the world you are. Australia, there's nothing wrong with medicine in Australia. It's good medicine. The problem is that, to be quite honest with you, the problem is they don't understand where back pain comes from. What we've done is we've discovered the source of back pain. And once you know the source, then you can create solutions for the sources. And depending on the type of source, you have a different solution, right? Facet and disc are different. So I think your biggest issue you're going to have in Australia, and it's the same in America, by the way, and anywhere you go, is doctors don't know how to diagnose the source of back pain. And an MRI scan never tells the doctor where pain comes from. If you show them your MRI, they're going to say, we don't know where your pain's coming from. And they would be right. They don't know where your pain's coming from. Okay? So to be able to diagnose the source of pain, you have to know where pain typically comes from, so you can come up with what's called the differential diagnosis. Watch out for that needle. The differential diagnosis is basically, if somebody shows you where their pain is, say their lower back, you can, at least in your head, have an idea of what things in that area can cause back pain. That's called the differential diagnosis. So when somebody says my back pain is here in the lower back, number one thing I'm thinking of is a disc problem. Number two is facet. Number three is fracture. And then there's infection and tumor, right? There's really nothing else that causes pain in this area, nothing. So if you're talking about the area just above the butt crack, right, above the butt crack here, you got facet joint, you got disc, you have fracture, you may include the SI joints, and then there's really not much else other than tumors and infections in the pelvis. And the MRI would see those, so if it's not on the MRI, there's no tumor on the MRI, there's no infection on the MRI, then you're left with these things that we typically know cause back pain, and that's the key, is knowing what typically causes back pain. The problem is the doctors around the world don't know what causes back pain, and I've tried to publish what we discovered as the sources of back pain, and they don't want to hear it. They basically they're opposed to identifying, the journals are opposed to identifying the sources of back pain. Shot? And the reason for that is simple. Once we know what causes back pain and everybody knows, then everyone's going to want to fix it. And I think that's great. We want doctors fixing back pain. The problem is insurance companies don't want doctors fixing back pain, because they know that once the word gets out that we've got a cure, everyone's going to want it. So there's going to be what we call a run-on treatment, where everybody wants, millions and millions of people are going to suddenly want to get their back fixed. And the insurance companies are deathly afraid of that, because back pain is the number one problem people go to the doctor for in the United States and probably worldwide, chronic back pain. Let's see. And so we've got an ethical, moral dilemma here, where we've let insurance companies basically determine when people get treatment. And insurance companies lose money every time you get treatment. So we're trusting these insurance companies to look after us, yet they're not interested, Sean, in fixing you guys, because they don't want to pay for it. That's really what it comes down to. We need to fix the problem with insurance companies. And believe me, it's not just about back pain and neck pain and fixing it. It's about tumors. It's about kidney problems. It's about sinus problems. I mean, it doesn't matter what field of medicine you're talking about. We have insurance companies denying treatments for patients that will fix patients all the time. In America, we have had 850 million denials last year for treatment. The insurance companies said no to the doctor 850 million times. That's too much. They've basically taken control of the entire healthcare industry, and doctors have given up fighting them. Well, we have not. At Duke Spine Institute, we continue to fight every day for our patients to get the care that they need. And we've decided we're not going to let insurance companies keep us from fixing people. And what we need people saying, I'm not going to let my insurance company keep you from fixing me. We need more people to say that. And then we need them to fight their insurance by suing their insurance company for not paying. And that's the only way we're going to force the insurance companies to pay. So raise awareness, and that's why we do these live streams. Thank you for your comment. I do this because, number one, I want to engage the audience, and I want to be able to talk to you about what I know about spine and medicine, so I can educate the world, because I feel like there's a lot of lying out there by doctors, insurance companies, hospitals, and implant companies. Everybody's lying to patients. And I didn't become a doctor to be part of their scam. I became a doctor to help patients get better. So I realized to do that, I have to depart from what everybody else is doing, and I have to do what's best for the patient, which is this surgery right here, when nobody else is doing it, and I got to do it because this is what's best for the patient. I don't do it because it's best for me. I do it because it's best for my patient. And it's best. This is the best treatment for about 1 billion people worldwide right now. 1 billion people. But I just can't get to them. All right, take a look at this. This is great stuff right here. This is it right here. This is the cheddar. Can you guys see this? At the end of the tube,
Yes, we
we
can.
are inside the tear. You see the inflammation. Remember, you guys watched the video a little while ago about how back pain comes from inflammation within the tear? There it is. That red stuff is the inflammation. And then you got the tear. It's pretty obvious right in the middle. And then you got the blue stuff, which is the herniated disc. So this is the cause of his back pain. It's inflammation within the annular tear caused by this blue thing here called the herniated disc. This is what we discovered at Duke Spine. I discovered it 20 years ago as the source of back pain and neck pain. And then we go in here and we take the herniation out, and we debride the tear with a laser, and that gets rid of the inflammation, and it gets rid of the source of inflammation, which is the herniation. You can discharge the first patient, but I haven't seen him. Our first patient's ready to leave. He's doing fantastic. He has no more neck pain. He's so happy. I will be done here in less than 5 minutes. All right, let's take some more questions.
Of course, this next one coming from Lanu on YouTube,
Hi, Lana.
asking, just curious, are there any needles or syringes insert to the arms during the surgery?
Yes, we have our patient's IV, right? So we have to give the patient anesthesia. We have to give him propofol to sedate him. We have to give him pain medicine. So because this hurts, what I'm doing hurts. And we have to give the patient Versed to make them not remember anything. So yes, we have to have IV access. We have to give IV fluids to keep him hydrated. So yeah, we have a IV in the arm, but that's it. There's nothing else inserted. Any other questions?
Yes, we have a couple more questions. Next one from Poodle Dog on YouTube.
Did you say poodle dog?
Poodle Dog.
I love it.
I love it. Asking, question, when you do a cervical operation, do you use anesthesia or propofol for C6 and C7? I am coming to see you, and I know you will help.
Oh, thank you. Yes, so if you're going to have a cervical disc laser done, we always put our patients under general anesthesia. You will have an endotracheal tube, You will be under general anesthesia with muscle relaxer and inhalation anesthetic, and it'll take you about an hour to recover. So the patient we did first this morning, if you go back to before this surgery, we did a 3-disc Duke laser disc repair, C6-7, C5-6, C4-5. That patient is already like ready to go home. He's asking the nurses to let him go. He wants to go have breakfast. So that first surgery we did, those 3 discs, if you go back and watch it on YouTube, that patient's like chomping at the bit to leave. He's like, I want to get out of here. So I'm gonna let him go in a few minutes. I'm gonna finish this surgery right now, and then I'm gonna go see him and say hi, make sure I answer any questions he has, just check him out, make sure he's doing good, and then let him go. But this is outpatient surgery, okay? It differs from the invasive surgeries you guys are used to for spine, where patients have to go to the hospital and spend the night in the hospital, and they have to be on a morphine pump or getting morphine because it's so painful having that surgery done. Those invasive spine surgeries like laminectomy and discectomy, you don't want those type of surgeries. The reason people have pain afterwards is the surgeon is cutting and destroying your muscle, your ligament. They're cutting into your muscles and cutting them and destroying them. And those muscles die. They die over the course of, say, 2-3 weeks. And as they're dying, they're releasing this mushy muscle liquid into your body. And that mushy muscle liquid is what causes pain. It causes inflammatory pain. And yeah. I've got about 3 minutes left. And that's why patients who have invasive surgery like discectomy, laminectomy, fusion, artificial disc, that's why they have so much pain after surgery, is the surgeon did destruction inside their body of all their soft tissues. My advice is stay away from those treatments. Just about done. This is the last of the tear. You guys see all the inflammatory tissue around it, the pink stuff? We're about to get sensitive right now. Any other questions?
Yes, we got a few more coming from. Next one coming from Charlie on YouTube.
Watch his blood pressure. It's going to probably go up.
Charlie
Go ahead.
asking, can neck soft tissue inflammation resulting from cervical stenosis, both central and foraminal, also interfere and put pressure on the vagus nerve? If so, what symptoms would you experience?
Yeah, the answer is no. Herniated discs do not affect the vagus nerve, ever. Ever, 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 never. The vagus nerve runs inside what's called the carotid sheath. The carotid sheath is a very thick connective tissue sheath that wraps around the carotid artery, the jugular vein, the internal jugular vein, and the vagus nerve runs between the vein and the artery. It's protected completely, and there's no way any kind of a herniation, 30 seconds, is going to ever cause inflammation that would affect the vagus nerve. Not with it in the neck. Now remember, the vagus nerve comes from cranial nerve 10, so maybe somehow it affects the spinal cord or brainstem, which is where cranial nerve 10 comes from. So a herniated disc could cause inflammation of the dura and the spinal cord and kind of brainstem, but within the spinal canal. 1 minute. Just about done. Any other questions?
Yes, this last but not least coming from Hassan on YouTube.
Hello, Hassan.
I believe this is a
Welcome.
comment and/or seeking advice saying, I was diagnosed with L4 to L5 and L5 to S1 disc herniation. Oh, just got another question. Disc herniation 1.5 years ago, and I am concerned about surgery because I am not in a position for advanced open surgeries. I don't want to undergo open surgery. I would prefer your procedure. However, I don't have access to it in the USA.
Well, I mean, sorry to hear that. So, first of all, you should not settle. I was telling Jason last week, our viewer Jason, you said, I can't make it to you. I said, find a way to make it to me. It's worth it, folks. If you want exceptional results with the best results without complication, you need to come to Duke Spine. Find a way to get here. Find a way to get the surgery done. It's worth it. Ask your friends. Ask your family for help.
Thank you.
Ask your politicians to get this covered for you. But in the end, it's all about your safety. That's really what it comes down to. This surgery is the safest surgery for you. There are no complications. We've never had one in 20 years of doing this. It is the safest surgery possible, and more importantly, it's going to give you relief of your symptoms. Other surgeries don't do that. Okay. Thanks for joining us. Is there another question?
Last one coming from Denard on YouTube,
Hi, Denard. Welcome.
saying, "Hi, I had the honor and privilege of having a consultation with you. How much time between MRIs that you would need for it to be updated?"
Well, Denard, here's the thing. If you have an MRI, let's say it was 2 years old, and your symptoms haven't changed in terms of location, maybe it's still the same location where you're having your back pain or neck pain, then you don't really need a new MRI, as long as your symptoms haven't changed location. Maybe they've gotten worse, they're more severe, they're more common, they occur more commonly. However, as long as, like, if your pain was over here 2 years ago MRI, and now you have the same pain here, the 2-year-old MRI is fine. But if your pain was here 2 years ago, now it's up here, well, now we need to get a new MRI thoracic to see what's going on up there. All right? So to answer your question, if your pain hasn't changed in 2 years, then you don't need a new MRI. But 2 years is sort of the limit of what we would accept for an MRI. Okay? 2 years. Thank you, everybody. And Henry, why don't we leave our audience and our surgery today with a nice testimonial.
Of course.
We have one more surgery. It's a thoracic. Are we doing it here or the other room? We're going to do it here. It's a patient with thoracic facet pain. So pain in the thoracic region above the lumbar, and it's coming from the facet joints. We're going to go in and do our Duke plasma rhizotomy and destroy the pain nerve to those facet joints. We'll see you soon. I'm here with one of my post-op patients. We get a lot of requests for, Dr. Duke, can you show us a patient that had the surgery several weeks ago? Well, here's one. She had the Duke laser disc repair done at L3-4, L4-5. You were having back and leg symptoms before surgery. How are you doing today?
I have no pain today. I have no pain today. I suffered for such a long time. The leg pain was there for a good close to 3 years. I got to where I could hardly do anything. I'm normally an Energizer bunny. I'm always busy doing something all day long. It terribly curtailed my life. I couldn't hardly do anything without being in pain. And for a long time, I had to push through some just to do normal things, just to get me ready for the day. Now, it's gone.
Amen.
It's gone.
Now, you had your surgery done here at Duke Spine Institute in Florida in between two massive hurricanes, right?
Yes.
We had Milton recently, and before that we had Helene. And you had your surgeries smack in the middle of those two, between those two hurricanes.
Yes.
What brought you to Duke Spine Institute?
Well, my husband always trying to find something to help me. He did his research, and online we found you. So we came to see what you offered and what could be done. The other doctors wanted to fuse my back and L5 all the way to my tailbone, and I didn't want that. I was afraid of that. I had done decompression surgery at L3-4-4-5. Within a few weeks after having that done, I was right back in the same pain.
We tell people about laminectomy. You had a laminectomy, it
Yes.
didn't work. I tell people avoid laminectomies. They're removing bones and ligaments out of the spine. It's very invasive, bloody, and damaging. But the laser surgery you had with us, we went in with a small, tiny Band-Aid incision.
Yes.
outpatient. There was no bleeding,
And no pain from the surgery.
no pain from the surgery.
Wow.
Right?
I couldn't believe it. I'm like, you gave me a prescription for muscle relaxants, and I'm like, no pain surgery. I called to make sure. Are you sure? Because I don't have a drawer full of pain pills because I don't believe in them, but I know I need them for surgery. I needed them when I had my decompression surgery. I needed them when I had emergency cervical surgery, and I had no pain, no surgical pain.
Yes, our procedure is so
Wow.
gentle that there's no surgical pain and you don't need to take painkillers.
No.
Amazing. Well, thank you for sharing your story with us. And you've been through so much, and you're in my prayers. I hope you do very well. Enjoy life.
Thank you. I so appreciate the prayers.
You're welcome.